I'm Dr. Ryan Kaufman with Northwest ENT and Allergy Associates, and I'm here to discuss the risks, benefits, and alternatives of septoplasty and turbinate surgery. So, septoplasty and turbinate surgery is designed to improve the nasal airway by increasing the size and diameter of the airway and getting rid of any type of septal deviation or crookedness within the side of the nasal cavity. It's also designed to reduce the turbinates in their size and shape and form, but still allow them to perform their standard function, which is warming, humidifying, and filtering air. So the problem that you have is, again, your nose is obstructed or blocked up. The two main structures within the nasal cavity that block the nose are the septum, which is the midline divider of the nose, and when it becomes deviated or pushed into one nostril versus the other, that then causes obstruction or blockage on that side. What typically happens is on the other side, the turbinates, which are the small structures in the inferior aspect of the nasal cavity, then tend to swell. When these swell, these then obstruct the other side of the nasal cavity, leading to near total nasal obstruction. The risks of the operation include bleeding, problems with re-deviation of the septum due to trauma, secondary nasal obstruction due to allergy, and the possibility of a nasal septal perforation or hole within the nasal cavity. There is also the possibility that allergic rhinitis or allergies are a large component of your problem and may need to be taken care of in a separate manner or separate set of medications. The benefits of this operation are, of course, improvement in your nasal airway, increasing the diameter and the openness of the nasal airway. This also will allow you to deal better with nasal allergies if you do have nasal allergies by, number one, allowing the sprays and the medications that you're being administered to reach the areas that need it, but also by allowing that even when the nasal cavity becomes swollen, it doesn't swell as significantly and doesn't completely occlude the nasal cavity. The other options other than this surgery would be to, again, continue medications which you're currently on, including nasal steroid sprays, nasal antihistamine sprays, oral antihistamines, allergy shots, other medications and decongestants to keep you open. However, at this point, you've most likely failed maximal medical therapy, and that's why we're discussing this procedure today. The procedure typically lasts about 45 minutes to an hour. You'll come back to an operating room, go off to sleep completely. You won't remember anything and you won't feel anything. Then once you're completely off to sleep, we numb up the inside part of the nasal cavity. We make a very small incision inside the nasal cavity. There'll be no changes to the outside size, shape, form of your nose, no black or blue eyes, no obvious bruising. You will notice a small incision inside the nasal cavity, approximately 5 to 10 millimeters, which is about the width of a pinky finger. Once we're inside there, we do straighten out the deviated portions of cartilage in the divider of the nose or the septum, and we actually take out or remove a small portion of the deviated bone within the septum. So once these deviated portions of the nasal cavity are removed, we sew everything back together with absorbable sutures. There are no permanent sutures that need to be removed. Once the septoplasty portion of the case is complete, then we proceed with the turbinate reduction, which involves a small incision at the very front part of each inferior turbinate, and then utilizing a liposuction device called a microdebrider to remove the remainder portion of the hypertrophic or enlarged tissue. This removes the tissue from the inside out and doesn't create any outside effects on the turbinate itself, which limits nasal bleeding after the case. Once the turbinates are reduced, we actually outfracture them or move them out of the way to improve the nasal airway as well. Once this is complete, we rarely have to put in any type of nasal packing and or any type of nasal splints. Typically, suturing and the techniques that we use are enough to provide you with a widely patent nasal airway without having to use any nasal packing. In recovery from the operation, you'll notice as soon as you roll out of the operating room that your nasal airway is improved and you breathe better. However, about 6 to 8 hours after the procedure is complete, you will have a fair amount of intranasal swelling, and this will occlude your nasal cavity for the next 5 to 7 days. You'll also notice that you again do have some amount of blood-tinged nasal drainage for the first 24 to 48 hours. In dealing with this, you will need to utilize some type of mustache dressing or some type of dressing to catch the small amount of nasal bleeding so you don't have to blow your nose or constantly use a Kleenex. Once the bleeding is stopped, you may begin nasal irrigation or saltwater rinses to improve, again, the openness within the nose, as well as to decrease any crusting or any old blood clots or bleeding that may be present. This will improve your nasal airway, number one, but number two, it also improves the healing process. You can also use a little bit of intranasal ointment, such as mupirocin, bacitracin, or neosporin ointment, to hydrate the nasal cavity and also to allow minimal crusting around the sutures themselves. This will also help the inferior turbinates, as you do get a small amount of crusting at the leading edge of each inferior turbinate. Once that portion of the healing process is complete, continued utilization of nasal saline and ointment allow complete healing. During the postoperative recovery period, you're more than welcome to utilize a small amount of Afrin nasal spray, 2 sprays in each nostril twice a day as needed for bleeding. You may also use it slightly more frequently in the first 3 days if you do have any significant bleeding. You can also place it on a cotton ball and place it up inside the nasal cavity on either side if you have any bleeding from one side versus another. Other things to help in your recovery period immediately would be ice over the nose, elevation of the head of your bed to 30 to 45 degrees, continued use of nasal saline, and no nose blowing to limit any bleeding that you may have. Once you're recovered, optimal recovery takes about 4 to 6 weeks to provide you with an ideal nasal airway, but most people can return to work within 5 to 7 days with just some minimal nasal congestion. Thank you for coming to us here at Northwest ENT and Allergy Associates for your nasal surgery, and we hope you enjoy your new nasal airway.
This video is presented for general information purposes only. No attempt is made to include all significant risks and benefits of surgical procedure and may not apply to a particular patient. Review with your physician any questions before signing the informed consent form.